All right, let's dive right in. Today, we're talking about something that is at the very heart of your role as a CNA, grooming and hygiene. Now, I know it's easy to see this as just, a checklist of tasks, but we're going to flip that script. We're going to see it for what it truly is, a vital part of professional care that directly impacts a patient's health, their dignity, and their overall well-being. So, let's get into it. So, let's kick things off with a pretty basic question. When you think about taking a shower or brushing your teeth, what's the first thing that comes to mind? Feeling clean, right? Waking up for the day? Sure. But let me ask you this. For the patients you'll be caring for, is a daily bath just about feeling fresh? And the answer is a huge no. For your patients, good hygiene is so much more than that. It is a cornerstone of their health. It is literally their body's first line of defense against all sorts of illnesses and infections. And you're the one on the front lines, helping to keep that defense strong. So here's how we're going to break it all down today. First, we'll talk about care beyond cleanliness, the why behind it all. Then we'll get into the rhythm of care, sharpen our health detective's eye, explore why the patient is the partner, and wrap up with the power of touch. Okay, Section 1, Care Beyond Cleanliness. Let's really get into the science of why your role in a patient's hygiene is so incredibly important for their health. So let's start with this core idea. The skin isn't just a covering. It's the body's largest organ, and its main job? To act as a barrier, a shield that keeps out nasty stuff like bacteria and viruses. So every time you help with a bath, or apply lotion, or make sure the skin is clean and dry, you're not just cleaning, you are actively reinforcing that shield. Your work literally helps prevent infections. So we know why it's so important. Now let's talk about how all this care fits into a patient's day. In Section 2, the rhythm of care, we're going to look at the difference between the routine, scheduled stuff, and the equally important as-needed or PRN care. On one side, you've got your scheduled care. This is the predictable flow of the day, right? Early morning care, AM care, afternoon, and then evening care before bed. It's the foundation. But on the other side, you have PRN care. PRN stands for pro re nata. It's a fancy Latin way of saying as needed. This is all about being responsive. It's for a patient who is incontinent and needs to be cleaned right away, or for someone who is diaphoretic, which just means they're sweating a lot, or for a patient in a coma who has very specific, frequent needs. Both of these are absolutely crucial for keeping that body's defense system in top shape. And this brings us to one of the most critical parts of your job, Section 3, the health detective's eye. Seriously. Every single time you provide personal care, it's a golden opportunity to gather crucial information about your patient's health. You're not just a task doer. You are an observer, a detective. Okay, so you're helping a patient with a bath, you're applying lotion. What should you actually be looking for on their skin? This isn't just a quick glance. You've got to be intentional about it. Here's the key. You are looking for changes, anything new. Be on high alert for new rashes, bruises, or any kind of broken skin, because that's a wide open door for infection. Sniff out any unusual odors. Notice any bleeding. Look closely at skin color. Is an area suddenly red, or pale, or even bluish? That bluish tint, called cyanosis, can mean a lack of oxygen. Check for swelling and always listen to your patient. If they complain about burning or itching, that's a huge clue. You have to report these things right away. And your detective work doesn't stop with the skin. The mouth can tell you so much about what's going on in the rest of the body. So, what are the red flags you need to spot during oral care? Again, you're looking for anything that's not normal. Dry, cracked lips or bleeding gums, big red flags. Swollen gums could be a sign of gingivitis, and if you don't catch that, it can turn into periodontitis, which is a serious infection linked to even bigger problems like heart disease. You also want to note any broken teeth or dentures that don't fit well and are causing sores. Any of these observations are critical. You could be preventing pain, infection, or even problems with nutrition down the line. Okay, let's shift gears and talk about the most important person in the room, your patient. This is Section 4, the patient is the partner. This is all about moving away from doing tasks to a person and instead working with them. It's about promoting their independence and, most of all, respecting their dignity. It's a really simple question, isn't it? But the answer guides literally everything you do. When it comes to personal care, the timing, the methods, the products, whose preferences are the most important? It's the patient's, always. You have to remember, our grooming habits are deeply personal. They're shaped by our culture, how we were raised, what we can afford, and just plain old personal preference. Think about it. Maybe someone has taken a shower every morning for 60 years, and someone else is always bathed at night. Maybe they've used the same brand of soap their whole life. Honoring those choices means you're honoring them as a unique person. This is exactly why encouraging your patients to do as much as they can for themselves is so important. This quote says it all. Participating in self-care helps the resident attain or maintain their highest level of function and well-being. This isn't just about getting a task done. It helps them stay strong, and it's a huge boost to their self-esteem. Plus, it's actually a legal requirement under OBRA, the law that sets the standards for patient care. Every little thing they can do for themselves is a win.
All right, our final section, number 5, the power of touch. We're going to use a back massage as the perfect example of how one simple action can accomplish multiple goals all at once.
The procedure itself is pretty straightforward. You'll usually do it during morning care or to help a patient wind down before sleep. You'll use lotion to make it smooth, and the main technique is called effleurage, which is basically just long gliding strokes. It only takes about 4 to 6 minutes, but it can make a huge difference.
But here's the best part. While you're helping your patient relax and improving their circulation, what else are you doing? You got it. You're being a health detective. This is the perfect chance to do a really good skin assessment. You're looking for any red or pale spots, especially over bony areas, which could be the first sign of a pressure injury. It's comfort and assessment all rolled into one.
So, as we wrap this up, I want to leave you with this final thought. The care you provide, it's not just about what you do. It's about what you see with your detective's eye. It's about the infections you prevent by keeping that first line of defense strong. And most importantly, it's about the person you empower by respecting their choices and championing their independence. So the real question is, are you ready to be their first line of defense?